Hi, I'm Lindsey Smith welcoming you to Raise the Line with Osmosis from Elsevier, our ongoing exploration about how to improve health and healthcare. In recent months, public health advocates have raised urgent concerns about political developments in Washington that threaten decades of progress in protecting the health of individuals, families, and communities. Changes to vaccine policy, cuts to food assistance programs, rollbacks of environmental protections, and reductions in public health staffings are just few of the trends prompting alarm across the sector. To help us unpack these challenges and explore the path forward, we're honored to welcome Dr. Georges C. Benjamin, one of the most influential physician leaders in American public health. Since 2002, Dr. Benjamin has served as Executive Director of the American Public Health Association, also known as APHA, leading national efforts to create a healthier, more equitable America. His distinguished career spans military medicine, emergency care, academic leadership, and health administration, including his tenure as Secretary of Health for the state of Maryland. Dr. Benjamin is a prolific author, a trusted voice in health reform, and the publisher of two of the field's leading public health journals. He's also a member of the National Academy of Medicine and serves on the boards of 7 major nonprofits, and his insights have shaped policy at the highest levels. Additionally, he's been repeatedly recognized by Modern Healthcare and Washington Magazine as one of the most influential voices in healthcare. Dr. Benjamin, thank you so much for joining us today to discuss the state of public health, policy, and the future of healthcare in America. I'd like to start by learning more about you and what got you first interested in medicine.
Well, Lindsay, thank you very much. I'm an odd duck. I had absolutely no interest in being a physician whatsoever. I went to medical school to get a good basic science background so I could do molecular genetic research and fell in love with clinical medicine and then fell in love with emergency medicine and trained in the Army and did an internal medicine residency because that was what was available at the time. Although, interestingly enough, I was an intern in the ER the day the Army opened its first emergency medicine residency. So I grew up with Army emergency medicine and I stayed in it for about the first half of my career. And then I got a phone call. I was working as the director of the community medicine program at the city hospital in DC. My phone rings and the mayor says, "Have I got a job for you?" And I ended up being the city health commissioner for a couple of years, and the rest is history. It's kind of stayed in public health.
That's an awesome story, and thank you for your service, first and foremost. It's always really interesting to hear what shapes someone's path into medicine, especially in a field like emergency care. I want to talk a little bit more about what drew you into public health. Can you talk a little bit about the formative experiences in public health that you've had?
One of the things that you learn in the military when you begin involved in management and kind of community and population health very early on in the military, because at the end of the day, you are responsible for not only the troops under your command or for which you're medically responsible, but your families and anyone involved on that post that you're working. So kind of the concept of population health grabs you very early on in the military. And then, of course, having then got a job as a public health commissioner, I understood very clearly that I could influence a lot more health for a lot more people by doing public health. Although I got to tell you, I miss clinical medicine each and every day, but it really grows on you. And the truth of the matter is that policy makes a big difference, and public health does its work through policy.
Yeah, and I think public health requires that unique blend of that clinical insight, policy vision, which I think you embody so well from all of your experience kind of put together. I want to talk a little bit about APHA. Can you give our audience an overview of APHA and the role it plays nationally?
The American Public Health Association, which we call APHA, is pronounced as a noun, as a thing. We've been around since 1872, and it developed in a time when kind of clinical medicine and a recognition of the societal impact on health kind of diverged. So many of our members, of course, were physicians, they were nurses, they were public interest lawyers, were people in social science, they were environmentalists who came together to create a professional society to look at health and wellness as the principles of improving our society, in addition to, providing direct personal medical care. And we've developed it into a science and an art over the years. And so public health has become kind of a thing worldwide. It's been responsible for many, many years of improving the health and longevity of our population. And not to take anything away from our clinical colleagues who certainly save lives every day. But the truth of the matter is, by getting less people to smoke and getting our communities cleaner and dealing with sanitation, we've done a lot to improve the health and well-being of the population.
That's really helpful context. And I think APHA's reach and influence are vital in shaping national health priorities. And it's really impressive to see some of the work that you have done. I have no doubt that you guys are very busy these days. How would you describe the current moment for public health in the US? And secondly, are we at a turning point?
Well, the health of the public is under attack. And one of the things that the American Public Health Association tries to do is help people connect the dots, because we used to brag in public health, and I guess sometimes we still do, is that when our best work is done, nothing happens. And so one of the challenges that you have in prevention is that when something doesn't happen, people take it for granted. So the car accident that did not occur, the person who didn't get sick when they went to a restaurant to eat, the water that is clean and therefore nobody got diarrhea, the fact that you didn't get an infectious disease because you took a vaccine that prevented that infectious disease from occurring. All of those kinds of things make people complacent. And so one of the things we have to do a better job of is helping people connect the dots and recognize, look, you got up today, nothing bad happened to you while you were asleep. You got to work today, you got to school today. Nothing happened on your way there because of things that we've done proactively to make sure it was safe for you to do so. And, you got through your day, your kids got through their day, your spouse got through their day, and then you came home and you had nothing bad happen to you on the way because, again, of these proactive things that we've done. And, we also know that as we look at new developments, because, we're always innovating in our society, we have a role to help make people understand what those risks are. So it's wonderful that we now have these things called cell phones that allow us to do things that, we used to see on the movie Star Trek and on science fiction shows, but walking while texting, driving while texting, great innovation, but puts you at risk. And kids, who are Googling in school and not paying attention to class and who are paying more attention to the cell phone than they are to socializing with their friends, puts their mental health at risk. And so one of the things that we have to do in public health is we have to proactively recognize when we get these new disruptors in our society, how we can educate people on what the balance is to using those new tools so that they can improve their health or not put their health at risk.
So many good pieces to pull out of your response right there. But something that you said was our healthcare is under attack. And it reminded me of your title of the book that you co authored, Public Health Under Siege. Can you talk a little bit about that book?
That was a great book that we did with Brian Castrucci, who is the president of the De Beaumont Foundation, and I. And it was some learnings that we had for a policy meeting that we had here in Washington, D.C. And to point out that policy is very important and that health is policy. And that, a lot of people are concerned about politics. And the truth of the matter is that public health does its work through policy, and therefore we have to be involved with politics. What we have to not do is be partisan as part of that process. And so the book looks at examples of how people have used policy to try to improve people's health. And if you think about it, things like encouraging people not to smoke, dealing with data collection so that we know that we have opioid drugs in our community and that we're now seeing a rise in mortality from people overdosing on opioids. The fact that we now wear seatbelts and motorcycle helmets and trying to educate people on why we do these things. And while they may create some loss of individual freedom, that at the end of the day, it creates a much more healthy society, and that there is a role for both individual health as well as population health, meaning that we should do things to try to protect our own health, but we also have to help our neighbors protect their health. And vaccines, for example, is a great example where we get kind of a dual benefit. We both get to protect ourselves and we get to protect grandma by taking a vaccine preventable vaccine.
Absolutely. I think it's really important that we stay attentive, stay vocal, and committed to maintaining a strong public health system. So, what do you think the most serious threat to public health is today in the United States?
I think the most important thing is misinformation and disinformation. I think the challenge we have right now is that as a society, we've gone into our little corners and we live in our own ecosystems. We hear from the same people, we read the same books, we listen to the same radio stations, we Google the same stuff. We go on social media and we hear things that reinforce our core beliefs. And while having core beliefs is very important, I think that having a variety of influencers, people that give you information so that you can, you know, decide on what the facts are based on the facts and not based on things that are not true, helps us. And more people are getting their information from a single source, and they're getting bad information, and they're not validating that information to make sure that it's true.
Yeah, absolutely. I think that's such a valid point. So, what are some of the steps that APHA is taking to address some of the challenges like misinformation, perhaps?
Well, we're trying to help people figure out how to vet and understand the information they're getting. So the first thing we do is encourage people to go to what we consider credible sources. And I love a good rumor. I'm no different than anybody else. You give me a juicy rumor, I want to spread it in the moment. We're asking people to pause, validate before you share, and make sure that it's real, because there is harm in sending out bad information. And so we're also trying to make sure people understand that there's harm in doing that. And secondly, look, even when I say something, please validate it. I've made mistakes. I've told people the wrong things inadvertently. That was not my intent. But and I do try to correct it when I give the wrong information. But we're not infallible. We're all human. And I think it's important that people get stuff. And I tell people that if it doesn't sound right, it doesn't make a lot of sense to you, it probably doesn't. And the other thing is, if you hear something or you see something, always ask who benefits by giving you that information. Because sometimes people are giving you that information because it's a benefit to them and not a benefit to you. And so I always encourage people to ask that question as part of any information that they get.
Yeah, that's great. And just to play that back, find credible sources, validate it, and understand the impact of if you are sharing information that is truly inaccurate or misinformation. I think that's great tips for our audience. So I know that health equity is a major focus for APHA. What grade would you give the US health system in terms of equal access? And do you think it's heading in the right direction?
Well, tragically, our health system is not moving in the right direction. And people want to have an equitable healthcare system. But, we're the only industrialized nation, the only high income nation in the whole world does not have a system with everyone in and no one out. So I'm not arguing for single payer. I'm arguing for a system, which there are many models out there, to get everyone in this system. And, we now have people who are saying things like, and some of these, by the way, are public officials, who are saying things like people who deserve to have care. Well, the truth of the matter is everybody deserves to have care. And by the way, we behave that way. If you fall down in the street, we're going to spend hundreds to maybe millions of dollars to resuscitate you, take you to the hospital, put you in the ICU, try to fix you up. And so we behave that way. Shouldn't we build a system that is designed that way? So getting everybody in the system, making sure the system is affordable, and doing it from a societal perspective so that we make it simple to use the system. I'll tell you a quick story. So I had my hip replaced, and I was in the rehab center, and I was having trouble getting the outpatient appointment for my rehab. It just didn't work. I had to wait till I got home to go kind of call the orthopedist office and the rehab office and get that appointment set up. But you know what I could do? It turned out my cat, who was in the kennel, ran out of cat food. I was able to get on my phone, order food, and watch it be delivered to the kennel
Wow.
on my phone. But I could not make an appointment for a authorized procedure, you know, for an outpatient appointment. It just, the system wasn't set up to do that. Once I got it set up, the folks were wonderful. I had great therapy, all that kind of good stuff. But think about that,
Uh-huh.
and by the way, not only could I have done that, but I could have also on the same app ordered some food that I could have got snuck in for me at the rehab center. I just had to snuck downstairs to get it, you know? So the problem is our system isn't designed for the convenience of our patients. It's not designed for patient care.
Right. Thank you for sharing that story. I think that speaks to, the need to make the system easier for everyone. And I hope that your hip is doing well and your cat also.
Both are doing fine.
Okay, good, good, good. So, building on the previous question, what are some key actions that could help advance health equity, do you think?
So we know there are some things that actually result in inequitable outcomes. Number one, not having a system with everyone in and everyone out. Access to care is very, very important. And simply having an insurance card is not enough. The system has to be accessible. That means when you call, you have to be able to get an appointment in a timely way. It has to be affordable. We have to get rid of all of these patchwork systems that we have. We have a patchwork payment system, a patchwork delivery system, and they don't link in an easy way. And yet, pretty much every other part of our society has figured out how to remove the barriers to integration of our systems. I think that we also have to do a better job of individual acceptance of care. We still have a lot of people who, when they get a diagnosis of cancer, they just decide that they're not going to go in for care because they're afraid that they cannot be cured. And by the way, we have amazing cures for many diseases today. So people ought to make sure that they do that. And they also ought to do things that help improve their own health. So walking more, not smoking, drinking with moderation, all those kinds of things that we know the individual behavior is important to improving your health. People ought to do that. And then finally, our nation needs to recognize there's a whole range of things in society that either help us get care, help our health, or impede us from being healthy. Those are called the social determinants of health. So we know that education is important. We know that income is important. We know that transportation is important. We know that environment is important. Exposures to where we live and what we eat and all those things from an environmental perspective make a big deal. And we as a society in the United States invest less in the social supports than the other nations who all do much better with us at half the cost for healthcare.
Wow. Those are such thoughtful, actionable recommendations. So I appreciate you sharing that. And it was really highlighting as you were speaking that improving equity isn't just about, maybe increasing access, but also building trust on that individual level and ensuring representation while also holding our systems accountable.
And let me add one other thing. We still have discrimination in healthcare, right? We still have racism is still there. Inequity is still there. Not treating women the same as men, not treating people with mental illness the same as we treat people with physical illness. So we do have these structural inequities we have in our system we have to address.
Absolutely. I want to switch gears and talk a little bit about our audience. So, we have many students and early career health professionals in our audience. And I wanted to ask you, what advice would you give them about meeting the challenges of this moment and approaching their career in healthcare?
I always encourage people who are going to any of the disciplines in health to, first of all, get the best education that you can. And then I tell them, become an expert in something. Get good at something within your discipline so that you can feel that, I know everything there is to know about this particular topic. It not only makes you feel good about yourself, but it certainly can reward you in a career that you'll love and do what you like to do. I've always said that having a job that is fun, that every morning I want to get up and do it, is the most important thing to help revitalize you when things get tough, because these jobs do get tough sometimes. And you always have to ask yourself, why am I doing what I'm doing? And then I also encourage people to spend some me time. These jobs can be overwhelming, particularly the higher you go up in the system. So you ought to carve out some time and kind of do whatever you do. If it's sitting in a dark room, just doing some yoga or contemplating, it's listening to music, it's reading a good book, it's spending time with family or friends, but do something that is time for you, that helps you do what you enjoy doing, and build that into, if not every day, at least every week.
I know our listeners will appreciate your advice to get the best education you can, become an expert in something, do something you love, and lastly, take care of yourself. Self-care is critical. Before we kind of wrap up today's episode, I wanted to ask, what's next for you and APHA?
We are in a strange time in our nation, and we are challenged with so many people that aren't really thinking about the long view on the health and well-being of our nation. So we're going to try to stay focused. We're going to stay focused on the public's health. We believe that if we focus on the public's health, we can build trust. Trust building is going to be very important as we go forward. There's a lot of people that are questioning our policymakers, our resource allocators, because they're not being trustworthy. And I believe that trust is easy to lose and hard to gain. But the best way to be trustworthy is say the right thing and do the right thing, and always do what you say you're going to do. And if you do that, then you will earn people's trust. And more importantly, you will earn their respect. And once you've earned people's respect, then we can move forward and agree. And the other thing I recognize is we have begun getting into different camps, politically in the different camps. But at the end of the day, when something bad happens, like that tragedy in Texas with the flooding, we actually had a similar flood, by the way, in Maryland, in Western Maryland. People band together. When we have hurricanes and tornadoes, people band together. When bad things happen in our country, people band together. So I know that we want to work together. And what I encourage people to do is also seek out somebody who disagrees with you and find common ground with them if you can. And by the way, you usually can. Park the politics, find something. I have lots of people who have very different political beliefs than I do, but I can almost always find something that we can agree on. It may be sports. It may be our grandkids. By the way, grandkids are really good places to bond together on. And we work to try to find it, but it's hard.
Yeah.
It's hard to find someone you disagree with and find common ground, but you can do it. So I encourage people to do that.
I like what you said there about finding the common ground. So thank you for sharing that with us. And then what about for you personally? What's next for you personally?
Oh, I'm in there for a while. I've been at APHA for 23 years, and I'm going to continue to find ways in which I can push improving the public's health. I am obviously I do have grandkids, as I said. I spend a lot of time with them, and, I enjoy what I'm doing, and I'm going to continue to find opportunities for me to, enjoy what I do.
That's awesome. Thank you so much, Dr. Benjamin, for being with us today.
Thank you, Lindsey. I enjoyed being here.
That brings us to the end of today's episode of Raise the Line. A huge thank you to Dr. Benjamin for joining us and sharing his deep expertise and perspective on the evolving landscape of public health. From his early days in emergency medicine to leading the American Public Health Association, Dr. Benjamin has shown unwavering commitment to advancing health equity, shaping policy, and strengthening the systems that protect our communities. His insights on the current threats to public health serve as a powerful reminder of the work still ahead, and Dr. Benjamin continues to be a guiding voice in the movement for a healthier, more just America. I'm Lindsey Smith. Thanks for checking out today's show. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.